Good morning, all. Today's our topic is vitamins. Vitamins are non-energy yielding organic compounds and essential for normal human metabolism that must be supplied in small quantities in the diet. This definition includes the under inorganic ester, essential trace minerals, and essential amino acids and fatty acids, which are required in most much longer quantities. Other substances needed for proper growth of microorganisms or cells in culture are called growth factor. The different chemical form and procedures of a vitamin can be called uh, vitamins. The importance of the vitamins are as a drug is primarily in the prevention and treatment of the deficiency disease. Some vitamins do have other MP, empirical use in the pharmacological doses. Vitamin deficiencies occur due to the inadequate intake, malabsorptions, increased tissue needs, and increases excretion. Certain genetic abnormalities and drug vitamins interactions. Vitamins as a class are over promoted and over prescribed and overused myths like vitamins energy the body. Any physical illness is accompanied by vitamin deficiency. Vitamin intake is normal diet is uh, precariously marginal and vitamins are harmless are rampant. Vitamins are traditionally divided into two groups. There is a fat soluble, A, D, E, K. These except vitamin K are stored in the body for prolonged periods and are liable to cause cumulative toxicity after regular ingestions of the large amounts. Some interact with the specific cellular receptors analogous to uh, hormones. Now, water soluble, B complex and C. These are markedly stored and excess is excreted with little chance of toxicity. They act as a uh, cofactor for the specific enzymes of intermediary metabolism. Now, fat soluble vitamins, vitamin A, chemistry and sources. Vitamin S occurs in the nature in the several forms. Retinol is an unsaturated alcohol containing an iron ring and marine fish liver oils are rich sources. An appreciable amount are present in the egg and milk and butter. Uh, Dehydrogenases is present in the fresh water in fishes and carotenoids and pigments found in the green plants like carrot, turnips and spinach. Uh, Beta carotene is the most important carotenoid and it is inactive as such and molecules splice to the provides two molecules of the retinol. Man on normal diet gets half of the vitamin A as rational ester and half from the carotenoids. 1 microgram of the rationals is equal to 3.3 international unit of vitamin A activity. It is now called one rational equivalent is equal to 6 microgram of the dietary carotenes. Absorption and fat. Uh, Retinals palmitate cheap retinal ester in a diet. It hydrolyzes is uh, intestines to retinal, which is the absorbed by the carrier transports and the re-esterified. The physiological role of the action, visual cycle, retinal generations by the reversible oxidations of the retinal is a component of the light sensitive pigmented rhodopsin and which is synthesized by rods during the dark adaptation. These pigments get bleached and splits into the component by dim light and the progress generated and now impulses to the G protein called transductions and retinal release is the utilized. Epithelial cell vitamin A is promote differentiation and maintenance structural integrity of the epithelial all over the body. Reabsorption retinal is needed for the maintenance of the spermatogenesis and fetal development. Immunity increase susceptibility to infections occur in the vitamin A deficiency and physiological amount of vitamin A appears to be required for the proper antibody response. Deficiency symptoms, there is vitamin A is stored in the liver. Deficiency symptoms appear only after the long-term deprivations. Xeroxis, dryness of eye, dry and rough skin, keratinizations of the uh, bronchopulmonary epithelium, and unhealthy gastrointestinal mucosa diarrhea, increased tendency to the urinary stone formation, and uh, sterility due to the frailty, spermatogenesis, absorption, and growth retardation, uh, impairment of the spatial sense. Therapeutic uses prophylaxis of the vitamin A deficiency during infancy, pregnancy, and serotonin 3,000 to 500 international units per day. And the treatment of the established vitamin A deficiency 50,000 to 1 lakh international unit IM or orally for the 1 to 3 days. Skin disease like intermittent supplemental doses. The skin disease like acne, psoriasis, and like 2 to 3 third generations retinas are used. Interactions vitamin E promotes store and utilization of the retinol and decrease its toxicity. Regular use of the liquid paraffin by clarifying through vitamin A can result in the deficiency. Long-term oral neomycin include uh, steroria and hypervitaminosis A. Regular ingestions of the gross excess of retinol, uh, 1 lakh international unit per day for month, has produced toxicity, nausea, vomiting, and itching. Here the retinal acid, racemic acid, vitamin A acid. Racemic acid has vitamin A activity is epithelial tissue and promotes growth, but is inactive in eye and reproductive organs. All trans retinal acid, retinal receptors, uh, retinal and retinic acid acts through nuclear uh, national receptors, which functions in the manner analogs to the store receptors. Activation results in the modulations of the protein synthesis. And the vitamin E chemistry and sources. A number of the tocopherols of the which alpha tocopherol is the most abundant and the potent have vitamin E activity. The D isomer is more potent uh, L isomer, and wheat gram oil is the research sources. 1 gram of D alpha tocopherol is called alpha tocopherol. Equivalent is equal to 1.49 international unit of the vitamin E. The daily requirement of vitamin E is estimated at 10 microgram. It is increased by high intake of polyunsaturated fat. Absorption and fat. Vitamin E is absorbed from the intestine through lymph with the help of bile, and it circulates in the plasma and associated with the beta lipoproteins. Physiological role and action. Vitamin E acts as a oxidation antioxidants and protecting unsaturated lipid in the cell membrane, and coenzymes Q form free radical oxidations damage of the curbing generations of toxic pre-oxidation products. Deficiency and symptoms. Experimental vitamin E deficiency is in animal produce, recurrent absorption, degenerative changes in the spinal cord, skeletal muscle and heart, and hemolytic anemia. No clear-cut vitamin E deficiency syndrome has been described in humans, but vitamin E deficiency has been implicated in certain neuromuscular disease in the children. Therapeutic uses. Primary vitamin E deficiency does not occur clinically. Supplemental dose 10 to 30 mg per day may be given to the patient. G6PD deficiency. Prolonged treatment with 100 microgram per day increase several times of the erythrocytes. Pachnathiosides 100 mg per week. Normal oxidatives fragility, and the risk of the retrolental fibroplasia is premature infants exposed to the high oxygen concentration can be reduced by the 100 mg per kg per day oral vitamin E. Along with the vitamin A is enhanced in the absorption and the storage, and the large dose of 400 to 600 mg per day. The toxicity. Even large dose of the vitamin E for the long periods have not produced any significant toxicity. And antioxidants, vitamin E and beta carotenes, vitamin C is prevented by the cardiovascular disease and the cancer. And the antioxidants are believed to quench free radical, and free radical are atoms of the molecule with the silent and unpaired electron, which make them highly reactive. Several large absorption studies, 10 of the thousands, and their meta-analysis have failed to the demonstration any benefits of antioxidant vitamin in the cardiovascular events. And the large number of the antioxidant preparations so containing widely available of the vitamin B carotene and vitamin A reactive, vitamin E and vitamin C selective zinc, copper and magnesium creatinines.